Hello everyone, friends. In this video, I will continue analyzing one of the common causes of pain in the groin area, pelvic cavity, anteromedial surface of the thigh, knee, and even the lower leg, which originates from trigger points located in the adductor muscle group of the thigh. We know that the medial, or inner, group of thigh muscles includes 5 muscles: the Pectineus muscle, the adductor longus, adductor brevis, adductor magnus, and the gracilis. I have already covered the Pectineus muscle in detail in one of my previous videos. Today it's time to talk about the remaining 4. The adductor muscles are located between the quadriceps muscle group, which is in front, and the hamstring muscles, which are located at the back. The adductor longus muscle is located at the front. The adductor brevis occupies an intermediate position, while the adductor magnus, the largest muscle of the entire medial group, is located behind all the others. The Pectineus muscle lies above and slightly in front of the adductor brevis, while the Gracilis muscle is closest to the inner surface of the thigh, and one muscle from this group crosses 2 joints, the hip and the knee. The main function of all the muscles in the medial group of the thigh is to adduct the thigh. In addition, the adductor longus, adductor brevis, and adductor magnus muscles are involved in the internal rotation of the thigh. The Gracilis, adductor longus, and adductor brevis muscles participate in flexing the thigh at the hip joint, while the adductor magnus muscle is involved in its extension. The Gracilis muscle also helps to flex the knee and to internally rotate the lower leg. Trigger points located in the adductor longus and adductor brevis muscles cause pain inside the groin area and somewhat higher, as well as along the anteromedial surface of the thigh. Pain from these trigger points radiates downward to the anteromedial surface of the knee joint, extending even further down the leg to the area above the tibia. The pain intensifies with physical exertion and with sudden twists in the hip joint. Trigger points in the adductor magnus muscle are most often located in 2 areas. The first trigger point, located in the middle part of the muscle, is the most common and refers pain upward to the groin area and downward along the anteromedial surface of the thigh. Trigger points located in higher positions cause widespread discomfort within the pelvic cavity, sometimes radiating toward the pubic bone, the vagina, the rectum, and the bladder. Pain inside the pelvis can be constant or present as sharp shooting pain that occurs from time to time. Trigger points located in the gracilis muscle cause sharp burning pain that spreads up and down the inner surface of the thigh. The pain persists both during muscle exertion and at rest. Some relief from the pain may occur while walking. Chronic overload of the hip adductor muscles can lead to inflammation of the pubic symphysis, tearing of the adductor muscle attachments, periosteal detachment, and even fracture of the pubic bone. Such conditions can occur, for example, in professional long-distance runners, dancers, track and field athletes, or even in military personnel performing an exhausting march with a wide stride. Trigger points can also be activated during fast horseback riding, skiing, skating, long bicycle rides, or when slipping on ice, when the legs slide apart and you have to forcefully resist this movement to maintain balance. An awkward attempt to do the splits or a sudden sideways kick at the ball during a soccer game can also cause sharp, intense pain. A forced position, especially for women during sexual intercourse, as well as during childbirth, can lead both to muscle injury and to the activation of already existing trigger points. It should be noted that in a number of cases, trigger points in the hip adductor muscles make a significant contribution to the overall pain picture observed when diagnosing arthritis and arthrosis of the hip joint. In a significant number of patients who have been given such a clinical diagnosis, there is a substantial reduction in pain symptoms when performing specific exercises aimed at mechanically affecting the trigger points of the medial group of thigh muscles, followed by a series of targeted stretching exercises. There are 2 simple tests that can help detect shortening of the hip adductor muscles. In the first case, during the examination, the patient lies on their back with one leg bent at the knee and the heel brought as close as possible to the pelvis. The doctor, stabilizing the pelvis with one hand, uses the other hand to abduct the thigh of the bent leg. If movement is restricted, the foot of the bent leg will be closer to the knee of the straight leg, and the knee of the bent leg will be raised significantly higher above the surface of the couch or floor than normal. The second method of examination is also performed with the patient lying on their back. In the first phase, the examined leg, straightened at the knee, is moved to the side and partially flexed at the hip joint. This movement allows for the assessment of the condition of the posterior part of the adductor magnus muscle. In the second phase of the test, the leg is lowered very slowly and smoothly, which makes it possible to detect limitations in the stretching of the Pectineus, adductor longus, and adductor brevis muscles. At home, you can provide therapeutic effects to the adductor muscles of the thigh by rolling them on a large massage roller followed by stretching. To do this, take the roller and lie on your stomach, bending and abducting one leg at the hip joint. Place the roller perpendicular to your thigh and apply slow, intense pressure to the muscles and fascia in this area for several minutes. For more localized and deeper impact on trigger point areas, you can also use a large massage ball. After performing this same exercise on the other leg, you should proceed to stretching the adductor muscles of the thigh. For this purpose, I recommend understanding and using the principle underlying the following exercises. Sit in the butterfly position, bend your knees, and bring the soles of your feet together. Grasp your feet with your hands and pull them closer to your pelvis. Push your lower back forward to create a lumbar lordosis and maintain this back position without rounding it. Engaging your hip abductor muscles, try to slowly lower your knees down toward the floor as much as you possibly can. Hold this final position for 1 to 3 minutes while combining the stretch with deep and calm breathing. With every fourth exhale, try to lower your knees even further. After completing the exercise, slowly bring your thighs together and sit in this position for a few seconds. Then take a strap, make a loop, and lie down on your back. Bend your leg at the knee and slip the loop over your foot, then straighten your leg. Without lifting your head off the floor or raising the opposite side of your pelvis, pull your leg toward yourself and to the side. Continue to maintain deep breathing. And with every fourth smooth exhale, try to bring your leg even further. Hold the position for 1 to 3 minutes. Then slowly bring your leg back to the center and lower it to the floor. Switch legs and repeat the exercise on the other side. Here is another similar, effective and accessible exercise. Sit sideways next to a wall and lie on your back, turning to the side so that your pelvis is as close to the wall as possible. Straighten your legs and gently start spreading them apart. You can slightly assist yourself with your hands, applying additional pressure to your legs. The breathing technique and holding time in this exercise are the same as in the previous ones. Then slowly bring your legs together and return to the starting position. The stretching exercises for muscles and fascia demonstrated in this video can, of course, be performed in isolation, but they will yield the best possible results if you work on the whole body comprehensively, while giving extra attention to areas where you feel the most tension. If you are suffering from the pains described in this video, in addition to the demonstrated exercises, you should also pay attention to your sleeping position. To prevent persistent shortening of the adductor muscles while sleeping on your side, place a pillow between your legs. Your legs also should not be excessively bent at the hip joints. When you are sitting, you should avoid crossing your legs or placing one leg over the other. When sitting in a chair at your desk or in a car, just like during sleep, avoid positions with excessive hip flexion. Thank you for watching the video. Stay healthy. Wishing you excellent well-being. Watch the video about the Pectineus muscle if you haven't seen it yet. It complements the information presented in this video. See you next time.